Hi, I'm Jessie Dennerline. I'm the Director of Business Development here at New Roads Treatment Centers. I think that there can be some similarities in the way that celebrities feel and the way that people here in Utah feel. We have a conservative culture here, and I think that there's a lot of people that really want to be perfect. They want to look perfect, feel perfect, and Utah has a high rate of prescription drug addiction, and I think a lot of that ties into our need to always feel good and always look good and always be our best. So I do think there's some similarities between the life of a celebrity and the life of maybe an average woman here in Utah. I would say a mental illness or even an addiction is out of control when it starts to cause problems in your life. So it may be affecting relationships or your job or maybe even your physical, or mental health. So once something starts to affect you in a negative way, that's when I would say it's a problem and something that needs to be addressed. I wouldn't necessarily say everyone has mental illness, but things like depression, anxiety, those can all be normal emotions that a person has. So, some things are overdiagnosed and misdiagnosed, and I wouldn't say that everyone has some sort of diagnosis necessarily, but it is normal to deal with, certain emotions on a daily basis. I think a lot of the stigma around mental health really stems from not talking about it openly. I think mental health and addiction have always been things that families feel like they have to sweep under the rug, especially here in Utah with it being so conservative. I think that the more we talk about it openly, especially when it comes to celebrities and people that are dealing with these issues in the media, the more open and honest and positive that we are about it, I think that will help with all the stigma that goes around it. I think what hurts us the most is keeping it secret and all the shame that goes with mental illness and addiction. So here at New Roads, we have a lot of people that come in and they're on prescriptions that have been given to them by their doctor. But many people abuse those prescriptions, and in a lot of cases have become really dependent to where it's controlling them. So we'll have them meet with our doctor, who's an addictionologist, and possibly even a psychologist, and we'll try to get them on, if they're on something that can be abused, we'll try to switch their medication. Our ultimate goal is to get people off of all medications when possible, but sometimes that's not an option. There are certain mental illnesses that really are stabilized by medication. So our goal is to try to get everyone off, but when we can't, we try to get them on something that can't be abused, something that's safer for them to be on long term. I think a good way to bring mental health and addiction, to the forefront is legislation. We just did the Rally for Recovery up at the Capitol, and we're trying to bring more attention around these issues so that we can get more funding. The biggest barrier for people getting help usually is funding. It's very expensive to provide services, so therefore it's very expensive for the average person to receive these services. Insurance is another barrier. There are a lot of people who are either not insured or underinsured. So if we could get more people on insurance and also more coverage that covered mental health and addiction, so we could do more preventative medicine, then I think we would be able to help a lot more people before their problems got to the point where they're severe. Well, we have lots of wonderful success stories here. Many of our staff members are graduates of our program. We found that long-term treatment has been really successful for our clients. When they come into our program, they're in inpatient treatment for a minimum of 90 days, and then they can go step down to our transitional level of care, and that's usually 6 to 8 months long. So statistics show that the longer a person stays in treatment, the higher their chances of staying sober are. And that goes along with mental illness as well. The longer that they're in a safe environment where they're receiving therapy and good treatment, the better their chances are of continuing that after they leave treatment. So we've had really good success with our clients being able to stay sober and healthy mentally long term. So addiction and mental health issues really affect everyone. Pretty much everyone knows someone or is dealing with something themselves. So for more information, you could come in, and if maybe you don't know, if you're not sure if you have a problem or not, you can just come in and schedule an assessment, speak with a professional. They'll kind of ask you some questions and get a full picture of what's going on, and you can do that here at New Roads. Our phone number is 801-669-5888, or you can contact us through our website at newroadstreatment.com. So lots of options. The first step is just giving us a call.